Well, good evening and welcome to Science Cafe New Hampshire. My name is Dan Marchek and I'm one of the co-founders of Science Cafe. How many people are here for the first time? We have a few new people. So I'll just go over it briefly. Science Cafe is intended to be a public discussion. It's a place where we can come and talk about things that are important to New Hampshire. It's a monthly meeting most months. And what we do is we try not to have lectures or PowerPoints. What we'll do is give the panelists a chance to introduce themselves, and then we'll throw it open to question and answers. Now, my friend Rick Irving and I both have microphones. We are recording this tonight for cable television, so please wait for the microphone to come before you ask a question, and hold it close to your mouth, sort of like an ice cream cone. It works a lot better. Panelists too. All right, so I'll briefly introduce our panelists. To my right, we have Dr. Mark Sadowski, who's a psychiatrist specializing in anxiety disorders and the like. He attended and graduated from Tufts University School of Medicine in 1985. And he is also a New Hampshire Magazine top doctor for 2014, 15, and 16. And to his right is Barb Tremlett. She's originally from St. Louis, but she completed her MBA at Riviere, her master's at Sedona University in metaphysics. And she's a doctoral candidate for her doctorate in holistic life coaching. So Barb has a very holistic view of the problem of seasonal affective disorder, and her mission statement sort of is, Barb is working towards a vision of building a business that educates individuals to take an active role in their personal health, become in tune with their bodies, and learn to trust their own intuition on the direction that their lives could take. So she should have some interesting comments.
Yes, she does.
And finally, to her right is Dr. Carlos Martin Cinto. And Dr. Cinto is a bilingual licensed clinical medical health counselor. He's also I believe our first international panelist coming from Spain. And he specializes in disorders of anxiety, PTSD, stress management, life transition, and the like. So I'll let them all introduce themselves and tell us why we should listen to them and their opinions. And maybe if they could start by just sort of describing what seasonal affective disorder means to them, that would be a great place to start. So with that, Dr. Sadowski.
I'm Mark Sadowski. I'm a psychiatrist.
Switch. Right. Have to put the switch on first. Okay. This is kind of high tech. So I'm Mark Sadowski. I'm a psychiatrist. I've been in Nashua now since 1989. And it was only several years before I got here that seasonal affective disorder was described clinically in the psychiatric journals. And it was characterized by seasonal mood worsening, and then some of the classic symptoms are increased appetite, weight gain, carbohydrate craving, increased need for sleep, depressed mood, impairment in concentration, decision-making, things like that. So it shares a lot of the symptoms of regular depression, but there was a seasonal component to it, starting in the fall and resolving in the spring. And there was also sort of an increase in frequency as you got more north, to more northern latitudes. We can talk a little bit about treatment, but I don't want to sort of monopolize things, but that's sort of the overview of how we in psychiatry tend to think about seasonal affective disorder.
Okay, so for me, I'm Barb Tremlett. I'm owner of the Holistic Self-Care Center up the road. And the reason I feel a passion toward this topic is because I had a child that 3 years in a row, when it came back to going to school, his mood started to drop, he got depressed, and we saw quite a bit of a different behavioral change in him. So after working with him for 3 years in a row and him being medicated and different things, trying to find a different approach to helping him, because I realized it was situational due to the seasonal changes. So I started to investigate what those seasonal changes can do to the human body and how to find more natural effects for taking care of him so he didn't go into the problem with the next year. So when he hit the 4th season of what would have been that pattern, we were able to break that pattern for him. So I felt really close to that for a long time. I do agree that being up in the Northeast or even the North with the cold, there's a lot higher incidence of seasonal disorder. So I think it's something that's really important to talk about and not be afraid to share ideas on how to work with that. And I appreciate being here tonight, so thank you very much. This is my first time here too.
Good evening. My name is Carlos. My last name has 2 words, Martín Finto. I am from Madrid, Spain. I am a medical doctor in Madrid from the Universidad Complutense. I am a psychiatrist in Madrid. But there is no reciprocity with the United States, and an American doctor is not a doctor in Europe, and I am not a doctor here. So I am a mental health counselor, and I am very happy of being so. The topic that we are going to discuss today is inserted in a much broader topic. We are very much accustomed to see seasons in the other beings. For instance, the trees, they lost the leaves, or they turn red, and then finally they fall. And in the springtime, the flowers show up. Unfortunately, we don't have leaves and we don't have flowers, so it's more difficult to see how the seasons affect us. This particular topic is a clear mark that we are affected by this, but this is only just a small proportion of how we are affected. I have a friend of mine that he used to tell me that he's convinced that in a previous reincarnation he was a bear. Because when it arrived this time of the year, he switches off. It's not that he was depressed. Simply, he forgot what he was doing, and he wake up around March or something like that, and oh my God, where are we? And he started to keep on with his very active life. He was a brilliant guy. But he has this hibernation period in this, without being depressed. What we are talking today is inside of the clinical depression, which is not what normally people say, I'm depressed. Clinical depression is a much deeper phenomenon. That population, in many of them, they have a big period of depression precisely in this season, the autumn, winter, till beginning of February or something like that. In some of them, it's not in this season, but in the springtime, but that's a minority. Most of them are around here. And this is the topic that we are going to discuss today, but feel free to comment in the other aspect of possible effect of the seasons to us human beings, that we are extremely complex. We have 2 nervous systems. One for the automatic process. That one is built with 2 systems, the parasympathetic and the sympathetic. One to accelerate, the other to brake. And then we have the conscious, normal thinking nervous system. But also we have a glandular system. We have glands. We have the suprarenal that produce the adrenaline. We have the ovaries. We have the thyroid that accelerate us or slow us, and so on. And on top of that, in a bone called sphenoid, which is on the base of the crania, there is a small receptacle that is called the Turkish chair, in which there is a gland called the hypophysis that is there, and that hypophysis has 2 halves. The frontal half, which is tissue, glandular tissue, and the back, which is nervous system. That nervous part of the back regulates the front part, and the front part regulates all the other glands in the body.
Thank you all for coming today. It's always interesting. These are always interesting. Dan hosts these a lot. Very interesting. I wondered if there was a genetic component to SAD, if there was something that we get from our forefathers that affect that. And the other thing is, how much does the environment affect us So I guess that's 2 questions. Do I get 2?
I can't answer on genetics, so those 3.
You know what, I don't know specifically about the genetic component. I suspect there is a genetic component, but I didn't look at those studies about that. But there is an environmental component. I mean, I think that one of the hypotheses and which has generated treatment is that it has to do with the amount of available light. You know, obviously, as you get further north, the days shorten, and that generated the hypothesis that maybe we could treat this with full spectrum light, which are the light boxes that people talk about. And that has been shown to be an effective treatment for seasonal affective disorder, as have certain types of psychotherapy have been shown, and a bunch of different antidepressants have been shown to be effective for treatment of this. So it's clearly an environmental etiology.
I'm going to strongly agree with the environmental. The further south you go, not that it doesn't happen, but there's less cases of seasonal disorder reported. And a lot of it has to do with not only the sunlight, which we all see the obvious part, it has a lot to do with people being inside more, being closed off more. I think a lot of us don't travel out as much when it's cold, snowy, icy, and so we tend to be more by ourselves. There's less communication. A lot of people wind up watching TV, watching video, and spending more time by themselves. So there's a lot of things that come from that, but it spirals away from that environmental piece. And environmental, when you're inside for a long amount of time, if you think about, there's, could be molds or mildews and things like that you wouldn't notice during the summer, but if you're inside more and your heating system that throws dust through the ducts when the heat comes on, there's a lot of environmental inside too that can increase the issues with the body being irritated.
Well, genetic is premature. We don't know genetics enough about any of mental health problems to say that there is, a concrete genetic condition that makes more probable to have this kind of thing, because we don't know what is the genetic condition for depression itself. So we really cannot answer that question right now. Well, hopefully in 10, 20 years, 30 years, we will be able to say something else, but it's too soon. We don't know genetics enough. Environment, as my colleague says, combined with behavior. And most of the therapies are, stimulating you, if you have that problem, to try to be alert that it's coming and make some, adjustment in your behavior to be more dynamic, to be more outside, to be more, catching as much sun as possible because of the serotonin problem, avoiding the melatonin so that they put you to sleep and so on. But the depressed people, when they're depressed, really cannot do anything of those things. When they are really down, they don't do that. They don't go out. They don't. They're depressed and they have difficulties sleeping. They have no motivation. A lot of things like that. And some of them they become suicidal, and you need to protect them and things like that. So yeah, the environment, as doctors say. The light is our strongest hypothesis, but we are not totally positive. There are percentages that are here around this area is like a 20%, and in Florida is like 10% or something like that. But it's the maximum that we can say for sure.
Are there risk factors, age risk factors, increase with age or anything like that?
The most frequent is around the 20s, but it's not exclusively, as everything in medicine, but the largest proportion is around the 20s, okay? Some of them, they become earlier, but normally in the 20s.
Okay, one of the questions was asking me earlier is how much I worked with kids. And what I noticed is that a lot of times, and I have a flyer I left out on the table just for some information, but what we notice a lot with kids that have the seasonal disorder, it usually starts after school, but it has a lot to do going from unstructured to a structured environment. with them, because you have the freedom of the summer. They can go to the bathroom when they want. They can do all these things when they want. But when you go to school, everything's very structured. So sometimes that leads to a seasonal disorder, because they know are the onset of some kind of a depression or control issue. So I wouldn't say it's necessarily younger only because of that, but there's a structural change which also can cause a form of depression.
I think I suspect that it has. When we were talking about the age of onset, I mean that's about the age of onset with depression in general. I mean, although we're seeing increasing earlier onsets, and I think that at times there's exacerbation of people who already have a history of depression. They can have seasonal exacerbation of the depression, and we have to be aware of that, because sometimes, depression is often a chronic recurrent illness, and then we wonder why people are having a recurrence at a certain time of the year, and you have to consider that, and perhaps even when people are on medicine, we may use light as an augmentation for the antidepressant medications, if we're using medications.
So what's the difference over here? What's the difference between depression and seasonal affective disorder? Then you seem to be using them fairly interchangeably.
Well, I mean, I think seasonal affective disorder from a psychiatric perspective is a subtype of depression that has seasonal onset, seasonal worsening, and as I said before, the classic symptoms of seasonal affective disorder are, sort of often the opposite of what we see in classic depression. That is, as I said before, in addition to depressed mood, there's increased need for sleep, increased appetite, carbohydrate craving, and weight gain. And oftentimes in sort of classic depression, people are having sleep disturbance, decreased appetite with weight loss, the same sorts of things with impairment in concentration, lack of energy and motivation. And the light therapy seems to be most effective with the classic seasonal affective symptoms. That is the increased appetite, weight gain, so it's sort of like a hibernation, as I think you were sort of referring to with the bear. I mean, it's sort of analogous to that, although clearly not hibernation like a bear, except maybe in your friend's situation.
I think one way to help a little bit from a layman's point of view is that if you have a depression, you kind of have just that ongoing vibrational lowness about you. But when you have a seasonal issue we call it as a temporary situation, or it's situational, where something stronger is happening to the body, that energy is affected even more. So it kind of goes up and down. You can almost see it in the actual season with some of the people that you work with. Regular depression, there are many avenues to take care of that, but when the seasonal depression comes, because it's situational, we can work with it a little differently, and it exacerbates a regular depression. So that's why sometimes there has to be kind of a separation, I think, of the description of it, and that's why I feel like depression is not what I'm working with. I'm working with the seasonal piece of it. So when it goes up and comes back down, and we can see it go up and how we affect and come down, then we know that the situation we're working with is truly the situational one, not the overall depression.
Have you noticed a difference in some of these warmer winters where we haven't had as much snow? And then second question, also, do you find the SAD prevalent throughout the world? Any comments on other countries?
Well, this may be counterintuitive, but there's been some thought that actually when there's more snow, there's less SAD, because you get the reflection of the sunlight off the snow. So you're getting more of the natural light than you might ordinarily get. And I think it is throughout the world. I mean, I think like the highest suicide rates in the world are in Sweden, and I mean in the Scandinavian countries. And so I don't think, so I think it happens throughout the world. Canada, Sweden, all the Scandinavian countries are afflicted by this. Finland, all the countries, Norway, what else is up there? Denmark. I'm testing him on Europe, you know.
I think that what he's saying is what we see also. I think the biggest difference between the warmer weather is there's a slightly less agitation because people aren't having to also deal with the coldness too. A lot of people, when you look at Ayurvedic medicine, a lot of people have a disposition where they're more warm-blooded and they get irritated by the cold. And because we migrate and we're all over the place now, we all move to different parts of the world, cold does affect a lot of people. So the more cold winter and the longer we're in, more people do get agitated at that point.
Well, since you wanted to talk about it, how does light therapy work? Do I have to go to a place and sit in front of lights, or do I get special light bulbs, or how exactly does it work?
Well, you know, I think it's actually much more accessible now. I think that on you know, I'll sometimes show people light boxes on Amazon. They used to be like $400, $600. Now you can get a small unit on Amazon, and I don't have anything with Amazon, but I just was looking at this, for like 50 or 60 bucks. And the characteristics of it that we talk about are full spectrum, 10,000 lux, which is the intensity, and then, you know, how far away you want to keep it, and you want to do it at the same time every day, which is first thing in the morning, and, you know, and varying. We usually start with like 15 or 30 minutes at a time, and, you know, and doing it 7 days a week. Now, you know, I often will talk with people about this, and you know, the fact that you have to make a time commitment like that is a limiting factor for people. And oftentimes I'd rather take, you know, medication or additional medication, because that's obviously a lot simpler than making that sort of commitment.
There are a lot of great products on the market. We actually work with a company called Meekend that has lamps that you put next to your desk, right at your desk, so you can do the light therapy while you're sitting at your computer every day. So there are some that are, and they're not extremely expensive. I don't know about the cost for the Nikon ones, but I know that's a high quality infrared specifically for seasonal disorder. And it's one we work with, but there are a lot of other good companies out there. So a lot of times, as a company progresses, they want to find easier and easier ways for you to get the natural therapy. And so that's one of the things we encourage.
So a couple things you need to know about light. First, you know, as I said, it's full spectrum light. Second is light decreases in intensity with this law called the inverse square law. So the further away it is, the less intense it is. So that's what I'm saying, it has to be within a certain distance. And the other thing is that, you know, people may know this, but antidepressants can sometimes make people manic or hypomanic. You know, that is, they can excite people. And light can do this too. So light has an antidepressant effect. So, you know, so it's important to consider what the dosing is. You know, you can't, you know, I think you got to be careful about, you know, sitting in front of a light all day, because you may get a little too elevated, you know, and that can become a problem too. You know, that is, people start, you know, having decreased need for sleep, increased activity, I mean, you know, spending sprees, things like that. So you got to be careful about it. So I don't recommend that people, you know, and I also don't recommend people generally use it at night, because it can be too stimulating and interfere with their sleep. So I think it's important. I mean, this is a biological intervention. One has to be aware of that, and I think careful with how one does it. You know, have some, you know, be prudent about how you're doing it.
Absolutely. So the research that goes with that material I was talking about is very well documented. So if you want to check it out, the research is there for that. And I agree, everybody's individual, and you don't want to overdose anything and underdose anything. So you're responsible for doing your own due diligence in it, but they have great research with the products that they have. Any reputable company will show you the research to support it.
What is your opinion on people practicing yoga, hatha yoga, not the kind where you candle gaze?
I think everything's individualized. Different people respond in different ways. I believe if you find any meditative practice that's going to get you to a place where you can be calm, get rid of that fight or flight syndrome and calm your anxiety, you're always in a better place. Some people are good with yoga and some aren't. I encourage you to do it if you're good at it, but if it's not, I still am going to help you find something else that will get you to that place of peace. So you can, once you're in that place of peace and you're calm, your body can react differently.
I encourage people to do yoga every day. I do yoga every morning. I wake up early to do it, okay? And I don't think you have to be good at it. I'm terrible at it, okay? I was the least flexible person in the world, but I've been doing it, and I tell my patients, you know what, this is what I can do. This is, this helps me. It helps me, because my job gets to be a little stressful during the day. And, I feel much better. So in psychiatry, we don't always do a lot of sort of talking about ourselves and what we do. But if I can talk about, what I'm doing to help somebody else, I think it's very helpful. And I think that there's tons of different schools of yoga. And there's all this free stuff on YouTube, and there are other good channels that you can do, and I tell people they can do chair yoga. There's all sorts of types of things that you can do. Even if you can't do downward facing dog, there's stuff you can do. Okay, so and I think it just helps a lot of people, and I think that the tricky thing that we have, I think in all of medicine is how do you motivate people to change, okay? And, we try to do all sorts of different ways of doing this. And I was thinking, it's a struggle for me, when I'm talking to patients who are very depressed, to get them to take these steps, but they'll come back to me occasionally and say, you know what, this has been really helpful to me, and I think that's a good thing, and I try to use that like virally, tell other people to do it.
Question about how you differentiate what is a pathological depression from the depression that people normally suffer in the course of their lives. Ever since I had a woman in her early 20s, who lived in my home, and I had no idea that she was depressed because she was charming and lively and a music student, a singer, a beautiful singer. She had been in talking therapy for many years, and then her therapist, or psychoanalyst, said, I think you need some medication, and put her on Prozac. And within a few weeks, she felt very much better, and said, I never knew what it felt like to not be depressed. I must have been depressed my entire life. So how do you go about diagnosing?
There are what we call diagnostic criteria for depression, and there's a book that we sort of rely on called the DSM. It's now up to 5. It's a diagnostic and statistical manual, and that lays out the diagnostic criteria for depression. So you have to have, depressed mood and inability to enjoy things, and then a bunch of other symptoms in addition for a diagnosis of major depression. But there are different types of depression too. There's, dysthymia, which is a sort of long-standing, sort of lower-level depression. Major depression can have grades, mild, moderate, severe, and with psychotic symptoms. People can have what are called adjustment disorders with depressed mood. That is, if there's a specific event and they become depressed. But in terms of what I think you're talking about, the other things in addition to having the symptoms of significant magnitude is they have to interfere with function, cause distress, and for major depression they have to be for at least 2 weeks. I mean, most of the time we're seeing people who, who it's much longer than 2 weeks. Like your friend, obviously, was much longer than 2 weeks. And then in addition to that, there are rating scales that people can look at. There's the, if they want to rate themselves on depression. But again, I mean, it's, we try to do it over the past 2 weeks. And, when you go into your doctors now, they'll ask you 2 questions, from one of these rating scales. I think it's you having difficulty enjoying things and you feeling down. But that's from the physician's health questionnaire. And there's one with 2 questions, and the one that I'll ask people has 9 questions. And that just gives me sort of a numeric baseline, and then we can sort of chart progress over time. But there's a bunch of different rating scales too. That there's the Beck's Depression Inventory, there's the Hamilton Depression Inventory, and the Montgomery-Asperg Depression Inventory. So there's all these different things, but to make things more complicated. But basically it's the magnitude of the symptoms, the duration, and how it affects a person's ability to function is how we look at it.
All that is true. And also with experience, you develop a nose, and you immediately know this is a clinical depression, immediately. And this is not. It's an intuitive thing. Intuition is not bad. It's a very powerful, intelligent tool that we have. People try to discard intuitive as if it is a second-class intelligence. No, it's not. And you have that. You see that person, oh my God, this is a depression. This is a clinical depression. This is a real one. And this is a big difficulty in life or something like that. It's not the same. It smells completely different. Besides all those perfectly exposed technical things which are like that. And then you need to go into DSM, and for how long, most of the day, 2 weeks, blah, blah, blah. Perfect. But regardless that, you have that feeling, oh my God, this is a real depression.
I think that's a good point. Is there's the general depression that the doctor was talking about, and then there's situational depression. And I deal more with situational depression because I deal with tools and teaching people how to change their philosophies of the way they look at it, or just change the situation around. One of the people that came into the other day said, I can't change the way that things are going in my life, but I know if I get the right tools, I could change the way I look at that. And so that's why I deal with the situational. When it's something that's deeper, at a different level, then we refer absolutely to one of the medical practitioners.
I'm reading your handout, and at the bottom of one of the columns it says, ask about earthing.
Well, that has a lot to do with, it's called grounding. It's when you're feeling lightheaded and you really need to ground yourself. It comes from the hippies back in the 70s on hugging a tree. Right? It has to do with loving nature and being a part of nature, being out in nature hiking, and really participating at that level of vibration of the earth, rather than being lightheaded and in the air. So the grounding, there's actually electrical current that runs through everything, including our human bodies, the trees, everything. And when you're able to be around a tree or you're around barefoot on the grass, you can actually discharge some of the energy from your body into the ground. And there's research that shows all of this is valid, and it's one of the things we've done over at the center a few times. Sometimes we'll take a group of people out, we take our socks off, we walk around the ground, and we talk about how healthy we are now, because we hug trees. Yeah, in the summertime, we don't do it in the winter. Good point. So the grounding is literally trying to ground yourself and discharge some of that energy so you can feel more balanced.
It's my impression that SAD has only been recognized for a few decades, and yet nothing you've said about either the symptoms or the causes or the treatments has changed in the last 100 years. I'm thinking of electric lights, and nothing in the causes has changed probably in several thousand. Why? What happened a few decades ago that caused someone to pay attention? Was there an event, or was this, what's different? Why did it happen? Why do we recognize it now?
I think it has a lot to do with anything in the medical community we recognize more. 20 years ago, I was diagnosed with fibromyalgia. My doctor didn't even know what it was, and I helped educate him as it became more obvious that you need to work with this. I think it's always been there, and I don't know what particular thing turned it on, but I know the medical community, as they become more knowledgeable, begin to recognize a lot of things that we never recognized in the past.
A lot of medicine is sort of what we might call serendipitous. That is you have to sort of see something and make the observation, detect a pattern, which is what I think you were talking about in terms of experience and intuition. I mean, you know, I think of intuition less as an abstract idea, but more as sort of, you know, pattern recognition, you know, and experience. And I think, you know, I think that when people look back, they saw that there was clearly, you know, for centuries, as you're alluding to, evidence of seasonal changes in mood. But in the early 1980s, I suspect what happened is somebody made the observation, they'd seen a couple of people who came in with very similar symptoms and had said, geez, I wonder if this is a syndrome that we might study more. And then, you know, then you become more aware of it, and you start seeing, and you start picking up, and you start saying, okay, so what are the commonalities of the symptoms that I think the microphone's got some seasonal changes here. So what are the commonalities of symptoms? And the symptoms that I was quoting were those described in that first paper from like the early 1980s. And then, you know, and then they started looking at the biological underpinnings, and they started using the light boxes and you know, the full spectrum light to try to mimic, you know, and again, it was one hypothesis, and then they found that was an effective treatment for that, and that the symptoms improved. So, but that's a lot how science works, and you know, that people make, you know, I mean, if you look at books like The Structure of Scientific Revolution, you know, I mean, you know, it's like you were aware of all this work that has been done, and then you make a connection on top of that based on your own observations, and you come up with a new synthesis. I mean, that's what Thomas Kuhn was talking about, right? So, you know, and I think that not that I'm saying that the person who came up with seasonal affective disorder is Einstein, or Newton or something, but, you know, clearly, you know, he was aware of this, you know, and so you have to have, you know, the receptivity, the openness to see something like that, and I suppose the academic bent to think about that. Because, you know, I think probably in everyday life we see things that are interesting clinically, and we don't go out and write about it, you know. But if you're an academic institution, you start doing things like that, and that's a lot how things happen. And sometimes it goes down false roads too. Sometimes you think you're seeing a syndrome, and it doesn't really, you know, turn out to be that way. So.
And that's a very good point, because allow me to explain something. I am a son of René Descartes. I don't know, Descartes, how do you pronounce in English?
Yeah, René Descartes.
René Descartes?
Right.
Cogito ergo sum, I think, ergo I exist, okay? And so that paradigm of the reason was totally in fashion, and people loved that. And everything that was out of that was second class. Don't pay attention to that. It's reasonable. And that was a perfect thing, because it's reasonable. So reason was in command, and we did fantastic things with reason. I love reason. But it was too pretentious, and tried to organize the entire society just through reason. And it's limited. Reason is limited, and didn't produce the big solutions that was promising. And after the Second World War, with the horror of the atomic bomb and all those things, people start to, and that's it. Go back to faith and all that we are in the middle of it right now. So the studies of things become more flexible, and people start to put money in things that 20 or 30 years before we're not been able to consider that, okay? And there is a more tolerant attitude toward almost everything, although then, all the natural medicine 30 years ago was, okay, impossible. Today it's absolutely tolerated and even stimulated and things like that. Acupuncture 30 years ago in Occident was ridiculous. Are you crazy? Now it's totally accepted, and so on. So it's a very good point, because we are in a transition moment, which is very dangerous, because if you go back to the blind faith, it will be horrible. I hope that we just civilize reason and make a good mixture of both. And that explains why we're studying these kind of things that are so difficult to grasp and too difficult to...
It's true. There was a time we laughed at chiropractors. There was a time we laughed at acupuncture. There was a time that people didn't understand Reiki. There's a time that people don't understand a lot of the energy medicine that's now current and very valid, like craniosacral. So being open-minded, when I teach nursing students, the first thing I ask them is, please don't sit there and try to challenge what I'm saying. Try to just be open and say, what if? Because it will open your mind to things. And as we know in metaphysics and quantum physics, everything's made of energy. So we don't always see everything. A lot of it's vibrational. And so there's a lot of things that are being opened up to us right now that we can use, and just because we can't see it doesn't make it not real. We use a lot of intuition where I'm at, we use a lot of energy medicine where I'm at, and we go by our results. So sometimes our attitude can affect our health. How many people have ever thought something long enough till they got sick to their stomach? Right? I can make myself sick in a few minutes thinking about my ex-husband, but I don't do that anymore because it's very unhealthy for me. But what we think about, we bring about, if we're really upset, we can make ourselves upset, and if we've already got a depression, then it can be worse. So I agree, Reiki and acupuncture and things weren't seen valid before, and there's a lot more coming down the pike that 10 years ago even I would have laughed at. There's one thing I've learned is how to be humble and how to accept that I don't know everything. And when it's introduced to me, I take my time, I evaluate it, I research it, I check for the validity, I work with other people, because there's way more out there than we even realize the power of that we're beginning to wake up to today. So it's absolutely, that's true.
Great. Well, please join me in thanking our panel for coming out on a cold winter night. So thank you all for coming. It's nice to see you.
Thank you.